TikTok is live, and then you guys are live on Facebook and YouTube, and the Instagram will load. If you guys want to talk, I'm going to test the volume. Okay. Hi. Hey, everyone.
That's welcome. Thank you all for coming. I want to thank Delegate Joshua Cole is here today to talk.
Thank you.
Really appreciate him coming out with his schedule. He's up for re-election next year, and I know has been busy around, but he is helping out in our district. He covers where we work, or where I work, and where I live, and so I'm really happy to have you on to get to talk.
I'm glad to be here. So whenever I do lives, I always say, come on in the room. Come on in the room. Make sure you share, and make sure people see that we are live and we're talking about healthcare today.
Yes, perfect. So as most of you guys know from my channel, I'm Dr. Erica Heppy. I'm a chiropractor in town. And one of the reasons that brought me back to the area is I was in California beforehand, but I was born and raised Spotsylvania, was the proximity to DC. I've always loved politics. I think it's a fun way to get involved and make changes. And being close to DC has been wonderful for lobbying. And for chiropractic, I got into it for helping increase Medicare equality, federal coverage for insurance benefits, TRICARE, VA coverage, and having this back and forth is fantastic. Yeah. And then I realized doing that at a federal level is wonderful, but then now at a state level, how important it is.
Yes, indeed.
And as much lobbying I've done through the American Chiro Association for chiropractic, I haven't done too much down in Richmond in the state. So just having you here and having your knowledge on the health board is greatly appreciated. Yes. So then what is your position down in Richmond? What are you responsible for?
So I love explaining, because what we find out is people know about Congress, they know about president, but they don't really know what happens like on the state level. Mm-hmm. So I am a state delegate. In any other state, it would be called a state representative, an assemblyman, or wherever you may be from, you may be familiar with those terms. But the state delegate is the lower house of the legislature. Virginia has the legislative branch. It's the state Senate and the state house, the House of Delegates. Virginia is the oldest legislative body in the Western Hemisphere. And so if you may remember from studying in history, the House of Burgesses, the House of Delegates evolved out of the House of Burgesses. So that's a great little nifty little point to have in your pocket whenever you talk to people. But as a state delegate, we make the state laws, we balance the state budget, and we appoint, basically oversee the governor's appointees. And we also appoint judges throughout the Commonwealth of Virginia as well. So it's a lot that we deal with. As a state representative, I sit on 3 committees in the House of Delegates. That's the Health and Human Services Committee, Privileges and Elections, and General Laws. That's all the boring laws that don't fit into another committee, so they throw them into that committee. But as a state delegate, I also represent what's called House District 65. That's the entire city of Fredericksburg, 22401, South Stafford. So if you live in 22406, 22405, I'm probably your representative. And Northern Spotsylvania County. So if you're in a small portion of 22407, anything around Spotsylvania Town Center over to Courthouse Road, I probably have you.
So that's the majority of our patients. So here, this is your representative, your delegate. If you guys have questions, the state, he's right here. Let us know. Let him know.
Yeah.
If you have questions. So then what have you been seeing and experiencing being on the health board?
Yeah, so
for the state.
This is actually my first year on the health committee. I don't have any experience in health, so I don't know how I got appointed to the committee, but it's actually an amazing learning opportunity to hear parents talk about the issues their children are facing, to hearing students bring up their issues, or even just family members and the issues they're facing with, whether it's in insurance, whether it's the Department of Health and Human Services, whether it's the Department of Behavioral Health. There are so many issues that are facing people in the Commonwealth of Virginia. And so I'm honored to serve on this committee to see what we can do. When we first went into session, the Speaker of the House created a new committee called the Rural Healthcare Committee. And he stated that there were issues that we were seeing coming out of rural Virginia, and we needed to figure out what we can do to help with legislation to rather increase accessibility, to help out with dental, to help out with mental health in our rural areas. And so over the past couple of months, I've been traveling all over the state, from the Plains, Virginia, to Farmville, to the Eastern Shore, Even here in our area, because we have rural parts of Spotsylvania County and Stafford County, and taking those issues that we're hearing from people to figure out what we can do to help them when we get back into session to make sure that people in our rural parts of the state have a little bit better access to healthcare and resources.
That's fantastic. So one of the things that I know we run into, and it's a complaint with patients, and I'm not sure if this federal or state, so if you can help me out, is insurance coverage for this. And one of the issues that we do for that virtual telehealth is that we can get covered for the first appointment, like a new patient evaluation, but then you can't. And I know chiropractic is different because we're very hands-on, but some people, if they want follow-up talks, then it's just cash after that because insurance doesn't cover it. And it's a turnoff for people. You pay for insurance, you have it. And that is one thing we do at the federal level. Is there anything at the state level then that we can do to help with that process, or
absolutely
with either reimbursement rates or just let patients know what is available to them for virtual? Because I actually had a lady in the other day, a new patient. She goes, I drove an hour and a half. And if the follow-up for you, she goes, if it's hands-on, I'll be here. But if it's, talking back and forth, let's do it virtual because of the drive.
The drive, And I think,
we're willing to work with anybody, but
and I think that was key when we first had our discussion about doing this. I was sharing with you that my insurance doesn't cover chiropractic services.
Yes.
And so,
which I'm not happy to hear, but I'm also happy to hear because you've been on the health board now. You
can make some changes,
right?
And
you see how tricky it can be.
And I think one of the things we can do, there are some things that are done on the federal level, but as it relates to maybe Medicaid or different access like that for those who are on Medicaid throughout the state, there are things that we have added to Medicaid from a state level. We expanded Medicaid back in 2018. That was before I got elected, but I was serving as the chief of staff for a delegate at that time. So I got to see that whole expansion go through. We came back in 2021, I believe, and expanded dental in Medicaid. So prior to 2021, those who were on Medicaid did not have dental coverage. But after 2021, we included that when we voted for that. And so there are certain things that we're going to be able to tweak and add in. And we're coming, like I said, I tell people this all the time. If you're not at the table, you're on the menu. And so we may not know what people are struggling to deal with. We may not know what people need help with. But as long as they raise those issues and they have those concerns, we can go in and say, hey, let's take a look at this. And maybe we can put this under Medicaid. Maybe we can put this under certain plans. Maybe we can put this in state plans for some of our state workers. So those are all the areas that we do have oversight in that we can help out on.
That's good to know.
Yeah.
Because that is one of the things that we love. And when I first opened up practice here, I took every insurance because I wanted people to have access to it. And I just didn't realize how tricky it can be, the reimbursements, the back and forth, and any help that we can give or help out. I saw one of the things that is up on the health docket too is what to do about the fentanyl crisis in Virginia. And that's one thing for the Foundation for Chiropractic Progress. One of our things is conservative care first, chiropractic before fentanyl, and helping out with the opioid crisis because it is a cheap alternative.
Absolutely.
So that is one of my plugs for you in the next Congress because I saw that's on your docket.
Absolutely.
So throwing that out there, like you were saying, bringing it to the table. That's one of the best things. I'm really happy that you guys are here watching today and that Delegate Joshua Cole is able to come in. Because that's the thing that's fascinating is patients come in and day out, and we hear insurance complaints all the time. And it's cool because that you're here because it's like you don't know where to go. You don't know who to talk to. Medicare, Medicaid, and Medicaid is a thing. There's different levels to it. So it's nice to know that we have somebody to reach out to and talk to about that because we want you guys to be covered. We want you guys to get the care that you need.
And if I could do my little shameless plug, I know we're not done, but if you have any questions or concerns or any issues, maybe it's beyond the scope of healthcare. If it's unemployment, if you need help with anything on a state-related topic, please don't hesitate to reach out to me. You can find me on all social media platforms at jcole4VA. If you use X, it's just at Joshua Cole. But send me a message. I'll try my best to help out. And if you want to go the official route, you can email me at DelJCole, that's DELJCOLE, at house.virginia, spelled out, .gov.
Thank you. And just the reason how we met, honestly, is I was following you online, social media. And I was following, and I saw Delegate Cole outside in a parking lot at a coffee shop. And I was like, I know you. And I like politics. I think that's how you make the changes, connecting. And you were warm, you opened up, you recognized me a little, and I was shocked that you even recognized me. I was like, wow, he's taking to his social media. And like we hadn't met, you gave me some signs, and then I just kind of hang out because I love your message. And then I like how you are willing, you're open, you'll talk to people. We send you a message and then you respond with the time that you have, and you're busy, you're driving all over the place.
Yeah.
Yeah, no, thank you.
Well, I always tell people, and this is so key, and this is why I love doing the work that I do on the state level. All politics is local, right? And so maybe some of you are watching today and you don't care about politics. You're not interested in politics. Listen, I get it. It's a lot. It's divisive. But what I want to encourage you is that politics is concerned about everything concerning you. And so whether we're talking about healthcare, right? You may not care about politics, but your insurance companies do. And that's how, they keep your premiums high. And so we have to make sure that we're involved in every level. Even if it's too conflated for you, at least have your hands to the plow or the ground on what's happening in the things you actually care about, whether it's for the schools and your kids, whether it's about the groceries and the prices, whether it's about access to various different things. We want to make sure that you're involved almost at every level so you can see what's happening right in your backyard. And just like how we connected at the local level, I want to encourage each and everyone who's watching today, reach out to me. Even if I'm not your delegate, reach out to me and I can get you connected to whoever your delegate or your senator is, because all politics is local. It affects us in everything and every day.
And you weren't my delegate for a few years there with the boundaries changing.
Yeah.
And then you redistricted, you're my delegate again. Yeah. It was fantastic. And like you were saying, it does affect every level. We are talking healthcare, but this is a small business. This chiropractic business, I started in 2017. My overhead was $600 a month for rent, $250 for my phone and my electronic health records, because I had to keep that down, and built up from there. And it pays the bills, it pays my mortgage. And it's one of those things that it's interesting now being a small business owner along with healthcare too, because I had 2 kids, no maternity leave, no paid time off, and happy to have health insurance. But it's one of those, it's interesting how many ways it does affect you. And you just don't even realize the nuances around it.
Yeah. And I think it's so key. And I got involved very early in politics. I was 14 years old. And here's another shameless plug. We have a program for middle schoolers called the House Page Program and the Senate Page Program. And so if you have a kid who's in middle school between the ages of 13 and 15, they can apply to work for the General Assembly. We bring them down for 2 months. They work for us and they get experience. And so that's how I got started. In 8th grade, I was an 8th grader at Drew Middle School. I got selected to be a page, went down to Richmond for 2 months working down there. And that's what kind of got my scope focus on state politics. And so I've been involved in state politics and focusing on state politics ever since I was 14.
That's amazing. All the changes too.
Yeah. And it's a lot. Virginia has elections every year. And so whether it's federal elections or state elections, if you're not paying attention, things can happen. I just got an email from a constituent who was concerned about a constitutional amendment that's on the ballot this year. And she said, this is good, but I'm concerned about this aspect that was left out. And I said, well, a constitutional amendment takes 2 years to pass. So they passed it before I got in there. We passed it again the second time. And I said, and this is why it's so important to know what's going on. And especially as a strong advocate for veterans' rights, you have to know what's going on so that you can make sure that if a bill is coming up that's going to relate to you or your family members or someone you're inactive with, you have to make sure that you have your voices heard. Because if she had known what was going on maybe about a year or so ago, she could have had that point inserted into the bill. And so it seems like we still got some more work to do.
But that's why you have to stay active, though, and be a part of it. That's one of the bills that I lobbied hard for with the American Chiro Association we wanted X amount of chiropractors in every VA facility around the United States. And we got a good number. We got our numbers in. But then, interesting enough, when the bill was passed, the rollout was such a long rollout that we had to go back in and then change the bill and remark it to the House and the Senate, get it passed again to say, no, we want all these chiropractors in the VA facilities in the next 2 years. You can't spend 15 years rolling out this process. And it's just little nuances that if you're not up on it, you're like, wait, this got passed. Right. What happened? What am I doing now?
And I think that's key. So one of the first major bills I passed, my first time in office back in 2020, I didn't realize that young people did not have hearing aids covered by insurance. So if you were under the age of 18, you had to pay out of pocket for your hearing aids. I had an amazing grandmother come in. She was advocating for her grandson. And I remember I had hearing aids when I was in high school. So I asked my mom, I was like, hey, didn't we have insurance cover this? She said, no, boy, I had to pay out of pocket. And so we passed that bill. But like you said, bills have a whole lifespan. So just because you read what was introduced is typically not what's going to get passed as the final product. So we passed that bill. It passed out the House, passed out the Senate. The governor signed it, and then COVID hit. So because COVID hit,
Uh-oh.
they rolled back a lot of the bills we passed. And so I didn't even realize my bill was considered null and void during COVID.
Oh, wow.
And so as I'm running for reelection last year, the grandmother reached out to me again and said, hey, remember the bill you passed? We have to do it again because it was null and void because of COVID. And so just keep in mind, as you're advocating for different pieces of legislation or you're advocating for certain changes, make sure you're watching the whole process because a bill could pass and it could have what we call a delayed enactment clause on it, which means you get excited because the bill passed, but it may not go into effect until 5 or 10 years later. So you have to make sure you're paying attention through the whole process because things can happen even after the bill passes.
That is so, I don't know, maybe our generation or the older generation remembers the When the Bill Becomes a Law cartoon for federal Congress. Yes. So how similar is that or different at the state level? And I guess this is kind of a two-part question. So for the federal, because, and again, all my lobbying is with federal, we have the bill written up by lawyers, and then we find a congressman who's very supportive, and then they introduce it into either the House or the Senate, usually a sister bill. We want both, House and Senate. And then we go around getting everybody we can to go. Yeah, exactly. And then we hope they do it before the next Congress rolls over. We don't have to do it again. And then it gets hopefully like tweaked through committees and then signed. Is that similar at the state level? Like, how does that work? Okay.
The only difference is we only have 60 days to get a bill passed, not 2 years.
Oh, no. Okay.
So
how many signatures then?
So, the way the bill works in Virginia is either one, a group of lobbyists or a group of activists or a group of, just say, chiropractors in the Commonwealth of Virginia want a bill passed. So either you all can write the bill and find a patron, or for many of us as delegates, we come up with ideas after having conversations, and we have lawyers in Richmond that we take the idea to. We can write the bill or we take it to them and they put it in the actual legal jargon or the lingo so that it fits into the state code. Once we have a bill introduced, it is good for us to have what we call a Senate or a House companion bill as well. Cognate is the terminology we use in Richmond, because if you have a cognate, that means you stand the risk of having both bills pass, or if one fails or there's an issue with one bill and it fails, you have the opportunity to fix it with the other side so that eventually you get it through. We don't have a limit or a minimum of how many delegates or senators can sign on to a bill. I had one bill where I literally had every single delegate and senator, all 140 members of the General Assembly, had signed on as co-patrons. And then I had plenty of bills where it's just been me by myself. And they have passed. So it does take that same structure, right? Introducing a bill, it's introduced in the House side because I'm on the House. It goes through the committee process. Once it goes through the committee process, if it passes, it goes to the House floor. Once it passes the House floor, it goes over to the Senate, and it goes through the same process again. If it passes both the House and the Senate, then it goes to the governor, and then the governor signs it. And then on July 1st, it becomes a bill.
Perfect. Thank you for that breakdown. No, that's one of the things that I feel we just forget the nuances, how similar and how different the state and federal can be.
Absolutely. Yep.
That's how difficult have you found it introducing bills in, or not difficult?
Well, since we're talking about health, I want to talk about a bill that we passed this session that actually I didn't think was going to pass. So as I was knocking on doors last year, I had heard from quite a few families who had children with disabilities, who were also on Medicaid. And during COVID, because a lot of nurses didn't want to go into people's homes during COVID, they had a program where they would allow, if you had a child with disability, you could pay yourself to take care of them during COVID, right? And we're seeing a lot of homes with children with disabilities where maybe one of the spouses or one of the parents stays at home, one goes to work, and that brings them down to a one-income household. I don't have to tell you, living in Fredericksburg, that is a terrible place to be in unless you're making some nice money. And so that program came in. It was a relief for many families because they took them back up to two-income households. But once the executive order for COVID, the emergency order went away, Medicaid, the Department of Behavioral Services kept saying, we're going to get rid of the program. We're going to get rid of the program. And they kept extending the program. But imagine for many families who are relying on that income, how dangerous and how scary that would be. So I had a couple families who said, hey, can you do something about this? And I was like, I'll put the bill in. I fought with insurance companies before. So let's see what we can do. I reached out. This is before I was I was appointed to the health committee.
This is why you got on.
Right.
This is what happens.
So I reached out to the chair because I knew he was already going to be the chair. And I said, hey, can we change this program? He said, there is an appetite for that. Go ahead and put the bill in and let's see what happens. So we get into session. I put the bill in. Another colleague of mine puts a very similar bill, which is a little bit more overarching. And I said, well, I'm just going to roll my bill into hers. That's one less bill I have to worry on. I can focus on some other things. And they said, no, still carry yours because yours is a little bit more focused. So if hers doesn't pass, maybe yours will. We go through the whole process. I introduce the bill. I'm standing up in a committee to introduce the bill. And then they ask, is there anyone here in support of the bill? There was a line out the door of family members bringing their children with disabilities. They were rolling them in. They were bringing them in. They were zooming in just to testify of how important this program would be if we made it the law of the land in Virginia. Well, needless to say, the bill passed out of committee, passed out of the House, passed out of the Senate unanimously. Not one person voted against the bill. And I thought it was going to fail. I didn't think it was going to pass. Right? And so it passed. It passed unanimously. There was no votes on the bill. And the governor signed it. And so effective July 1st, if you're watching this and you have a child with disability and you're on Medicaid, we want you to know that you can continue to pay yourself. That program did not come to an end. And so that was just one of the exciting things of how a bill can soar through the General Assembly. But trust me, I have had hard bills where I've introduced a bill and I've had issues all across the board. Sometimes the bill will die, and then sometimes a bill will be completely transformed into something it was not even supposed to be. And so I've had that issue too back during COVID. We were trying to protect renters who were being evicted. Maybe they lost their job because of COVID-19 or whatever have you. So we introduced a bill and basically said you could not be evicted from your house, basically like an eviction moratorium. But by the time we passed the bill had become landlords cannot report on your credit if you had been evicted due to a COVID-related incident. So see how it started off one way and then changed completely.
180. That is something. Yeah, COVID did landscape around in the healthcare and the field. That is one thing. Another thing that state to state changed for chiropractic in the profession. So it changes chiropractors. So we do 4 years undergrad and then 4 years of our doctors of chiropractic. And it changes state to state if there's a board of medical providers, board of healthcare, board of chiropractic. In Virginia, we're lucky because we're all under the one board of medicine. DOs, MDs, DCs. It's not like that state to state. And so when COVID hit Virginia, it changed state to state. Some states put chiropractors as you need to be working and some pulled them out because they were so hands-on. And Virginia said no and started filtering people from the ER, anybody with back pain, to chiropractors. Oh, wow. So COVID, it was interesting. It ended up spiking the practice numbers here. And I went from January 2020 was the first time I had hired an intern. And business was great. And then March hit. And then the intern, she actually got me on, she's now a chiropractor herself down in Florida. She got me on social media, didn't know what to do. She'd sit in a massage chair and people were like, wait, is she working? She'd check people in on the phone. She's doing videos. People are coming in. And it was all because we were like filtering in. We were cleaning all of this. And it was the state of Virginia and the Virginia Chiro Association that really fought to make sure. And it was fantastic because it helped filter. And we got a lot of people cleared out from around Mary Wash and stuff because back pain, they don't want to be there when they're taking over the COVID times.
And I was going to say, COVID was a very scary time. And so you want to make sure if it's something that can be helped in another area, we were trying to make sure we sent people other ways they could get in and get taken care of.
And we really appreciate that. You guys kept us on. So then what does your re-election look like? Is that next year? You're saying that? Or are you making the rounds now?
Next year is a big year in Virginia. So this is a big year, of course. It's a presidential election. It's a congressional election. So everyone's excited about that.
Mhm.
But once this is over in November, don't fall asleep because we have another major election in Virginia next year. Next year, it's the governor's race, the lieutenant governor, the attorney general, and all 100 seats of the Virginia House of Delegates. And for most of us, there's going to be local races as well. So city council, board of supervisors, school boards. And so if you are really concerned about the issues that impact you on a local level, like your sheriff, your Commonwealth's attorney, your school board, if you're having issues with what's happening in your community, that's your board of supervisors. So all of those elections are going to be happening next year. And the way Virginia does this is really weird. We do what's called off-year elections, and many of us, especially serving on the Privileges and Elections Committee, we see how Virginia for years has tried to prevent people from getting to the ballot. And you do these off-year elections because on presidential elections, turnout is off the charts, right? But on the off-year election, turnout is really, really low. And when that happens, you have delegates who get elected who are rich and wealthy. And then when they get down there, who do they appoint as judges? Their next door neighbor who doesn't care about criminal justice reform, who doesn't care about various different issues, making sure that young people are giving second chances. And so when those issues concern you, I tell people all the time, the way I protest is by writing legislation. The way you protest may be in the streets, but the way you also protest should be at the ballot box as well, to make sure that your issues and your concerns are heard and that the people that you're voting for are going to Richmond, going to DC to actually represent you.
No, that's an excellent point. And we'll have to reconnect and have you on again next year too, when everything. We're also having the future, hopefully, governor Abigail will be on December to talk for her, kick off to talk also healthcare as well. But that is the thing that we hear from patients. And with the election, people come in and they'll talk about it. And there is the heated side to side, and we lean our ways. But there's the griping of, well, they don't really do anything for me. They don't do anything. And I will say, these are the people, the local ones, the next year's election, those are the ones who make the difference and who are going to affect you at this ground level. And it is tricky, those off-year elections, though. So it's great to be in here and promoting that.
I remember as I was knocking on doors a couple of years ago running for office, and a guy said, nope, I'm not voting for you because you didn't pass this, you didn't pass that, you didn't do this, you didn't do that. I said, well, you're talking about Congress in DC. We have actually done all of those things on a state level in Virginia. And he was like, wait, y'all did? I said, go to this website. You can see everything that we've done. And he's like, oh, y'all really did it.
That's perfect. Oh my gosh, you must be knocking on doors constantly.
That's what I got to do. I have to make sure that people know.
Yeah. But that is the thing. We just don't know. And that's what I was shocked about too, as involved. Growing up in Spotsy, my parents were always having me at the marches and stuff. And even I didn't know how easy. It's so easy to connect with your delegates. Not absolutely. Like, sorry to tell everybody it's easy. They're telling a message and contact you. But I mean, if you want to make a difference, you can sit and talk about it with your friends. It's great. Or you can write those letters.
Absolutely.
Like the amount of letters that I just wrote out to, the White House. Why not? Nobody's going to read. Some intern winner is going to read those words. So.
But and I'll give you a little insight, right, to how we do things on a state level. So when you email us, and I'll tell a little bit on myself, we may not respond to all the emails if you're just asking us to vote on something or to support a particular piece of legislation. But I assure you, if we may not respond to it, we are seeing all of your emails that tell us to support this or to vote against this, and we take note of it. We have a little a device in Richmond that we use. It's called, and I don't know if I'm telling on ourselves if I can say it or not, but it's called iHod. It's what all the delegates use to look at all the bills, all the information about the bills. And what our staff does is every time we receive an email saying, hi, Delegate Cole, my name is such and such, and I'm a constituent, and I'm asking you to support such and such. We take those emails and they plug it in the system. And each time we receive an email, they take the tick up. So when I'm in committee and I'm looking at bills and how I'm going to vote, I have a little piece on the side that said 62 constituents emailed in support of this bill. Or, 250 Virginians emailed in support of this bill. But I try to get emails specifically from people who live in the 65th district and the Fredericksburg region to see if they support a particular bill. And there has been times where I've bucked against my party and said, you know what, actually, no. Can we put an amendment on this? Or actually, I can't support that for the people in Fredericksburg. And so it's very key. If you are concerned about a certain issue, please send me a message on social media. Please send us an email. And they have so many different organizations now that allow you to send what they call form emails, where you literally just put in your name and your address, and it will automatically send an email to me on your behalf. We see those, we check them. And like I said, I may not respond to all of them, but we see it and we're plugging it in the system so we can see how you want us to support these particular pieces of legislation.
That's actually excellent to hear about, because both on the American Chiro Association and it's Unified Virginia Chiro Association, we have links that I have on my Happy Chiropractic website, and it's for Medicaid and Medicare equality. Yeah. And what it does is it generates those forms, and we've sent those out too in newsletters and emails as well. And those are the emails that Delegate Cole's talking about. And that what it does is a form filled, and it says, I want Medicare and Medicaid. I want it to cover chiropractic care, or I wanted to have 30 visits a year versus 12 visits. And you guys are just signing your name and it just shoots out. So keep doing that, because they will get it and get those upticks up. Absolutely. That's wonderful. Yeah. See, every little bit helps.
Yeah, absolutely. And I think also too, and I just, for those people who are watching, I can't overstate the fact that your voice really does matter. I know it gets hard. Sometimes you feel like, your elected official doesn't hear you, your elected official doesn't care, but email, send messages. Many of us, it's different now because, when I was growing up, the only way to communicate with your legislator was by making a phone call, by sending a letter, or by going in person and seeing them. And now you can send us emails, you can send us a message on Facebook, you can inbox us on IG or whatever, and have access to us to make sure we know what's going on. And so I love it because, we'll get emails from maybe some of our older constituents, but young people will send me DMs on Instagram, on TikTok, or wherever, and say, do you guys do this? Can you change this? And I read it and I see it, and we want to hear from you. So I can't overstate it enough that your voice actually matters. So if there's anything that you're concerned about, or anything that you want to see changed or done differently, send me a message, let me know, and I'll find out if it's a thing we can do on the state level, or if I have to send you to Abigail Spanberger.
That's perfect. Yeah, thank you. And today also, what's special about today?
Today is early voting day.
Go out and vote. Get it done with.
Starting today.
And then they will stop emailing, texting.
That's a key thing, right?
Yes,
so
go out and
vote early, all the mail will stop, all that stuff that annoys you will stop. So starting today, every Monday through Friday, all the way up until the Saturday before Election Day, you can go vote early. If you live in Fredericksburg, it's down at, we call the Big Ugly, the Executive Plaza right there on Caroline Street. You can vote there. If you're in Spotsylvania County, I don't know the address, but it's the old Capital One building beside Golden Corral. Golden Corral and Massaponax, they have these two twin towers over there. That's where the early voting is in Spotsylvania County. And if you live in Stafford County, over by the Germanna off of Route 1, not too far away from the courthouse, the early voting at the registrar's office is there. So you can show up Monday through Friday, and check this out. The last 2 Saturdays before Election Day, you can actually go vote on those last 2 Saturdays as well.
That is amazing. I remember when Virginia changed that.
Yeah.
That's my mom. I grew up in Spotsy. My mom worked at Quantico her whole life, and every year I heard about the traffic getting horrific. And one of the things being DOD and government, you don't get off those election days. So when Saturday voting opened and those weekdays, and my dad was a carpenter who was driving all over the place, they took advantage of that. We were all over it.
And I think another thing we did too, so we made some great strides to making accessibility to the polling, the access to the ballot box was very clear. I think in 1 year, we went from being like in the lower 10 states for ballot access to the top 10 states in ballot access by the pieces of legislation that we did. And this is also key. It happened to me in 2015. I had just moved back from Lynchburg, and I went to go vote, and I couldn't vote because I was still registered in Lynchburg. And I knew for a fact I had changed my registration to Fredericksburg, but they told me no, I wasn't allowed to vote in 2015. So we now have what's called same-day voter registration in Virginia. So if you go vote, and maybe your registration, maybe you're a college student, registration is back home, or you just moved here and your registration is in Arlington, you can vote same day, register to vote right there, and then come back later and provide proof that you live in the precinct where you just voted, so that your ballot will actually count by that following Friday.
Oh, that's nice. That's really good to hear.
Yeah.
Especially for the students around there. That's I went to UVA, and back in 2008, that was a lot of what we did was like, got to get it in 3 weeks before, register, get everybody to register. And it was funny because 2008, the people that we were helping for also was Senator Kane at the time.
wow.
And now he's
Okay.
back up and running
Yes,
for this year.
re-election.
So re-election. Here we are, full circle, a decade later.
That's amazing.
Yes. Are there any questions, Claudia, that you see over there?
No, someone did make a point that there's just like more clear, that they'd love more clear information on where to go because they went to the elementary school to vote.
Oh, yes. Yeah.
So like, I don't know if you want to like touch on on that.
Yeah.
Then I'll look through the TikTok one.
Okay. So yes, when early voting is going on, some people have been confused. They think they show up at their voting location. Mm-hmm. You do not show up at your regular voting day location. You go to the registrar's office for wherever your locality is. And for many of the localities, you can just Google, like if you live in King George County Registrar or City of Fredericksburg Registrar. You Google it, it'll show you their website and it'll tell you where the early voting location is. Every locality is different. Mm-hmm. So they may have multiple spots where you can go vote early, or they may just have that one location at the registrar's office. So make sure you Google wherever your locality is. If you're in Fredericksburg, it's down at the Executive Plaza on Caroline Street. If you're in Stafford County, it's around the corner from the courthouse near the Germanna Stafford campus. I know I can't think of the address, but it's some of those new apartments right before you get to the hospital, Stafford Hospital. And then if you live in Spotsylvania County, it's near Golden Corral at the old Capital One Plaza over there. And as you get close, you'll start to see the signs that are directing you there, so you know you're in the right location.
That's for the last the primaries a couple months ago. I actually went on election day, which is rare. I usually do early, and I showed up at the Big Ugly.
Oh yeah,
and there were no signs, and I don't. Yeah. And I was like, well, that makes sense. It's a primary. Nobody really votes. Like this, there's construction. The elevators weren't working, so I went in the back entrance. I go up and like nobody's here. So I quickly Google. I'm like Dorothy Hart. So I mean, luckily they are all close together. So if you do end up at the wrong place, Google it. It's all in the district.
And I think it's key to keep this in mind. If you're voting early, it's going to be at the registrars. If you're voting on election day, whether it's primary election day or general election day, it's always going to be at your polling location that you're familiar with.
And early voting is at the state level next year as well, too?
Yes. So we have early voting in Virginia, period. That's going to be for state elections. That's going to be for local elections. And it starts 45 days before the general election day.
That's good. Good timing.
Yeah.
Yes. All right, we have a question. What does Josh think about the fact that other countries have successfully implemented universal health care, but we're told it's not possible?
Yeah, I think one, we can't do it on a state level. That would be super expensive. That is a federal issue that we have to consider. And I think for many people, they're really concerned about making that step. And so we've seen leaders like Senator Bernie Sanders, AOC, call for Medicare for all. And so we have to figure out a way that we're going to have to get the consensus of the public to get to that point as well. Because you're not going to be able to change the minds of the legislators in DC unless the mind of the public has been changed. And so there's so much that goes into that. I was reading an article recently that said Obamacare has been under attack for the past decade and it has finally won. That's good, but at the same time, we have so many people who need access to healthcare. Even with us expanding Medicaid, there are still people who are stuck between the cracks, and we still have to do what we can to make sure people are having access to affordable healthcare. And so if we want to see that done on a federal level, we have to make sure we're changing the mindset of the people in order to change the mindset of the legislators that are in DC to make that possible.
It for questions. People are probably still there, like kind of tuning in. So it's either wrap it up or we can keep talking. I know you were talking about like, and it was actually a really interesting conversation about like telehealth and how that looks in really rural areas. So
yeah. So as I mentioned earlier, I'm on the Rural Healthcare Committee, and I've been traveling all over the state just to see how rural healthcare is operating in the most rural parts of Virginia and what we can do to improve access. When I was appointed to the committee, I had three main areas of focus. My issue was transportation, dental and mental health. And so, as I've been on this committee, I've been able to raise those concerns. We've heard from many different people. But what I thought was interesting was going into this committee, I was under the impression that, all right, we're going to go into these rural parks. You know, they're going to have some things we're going to have to try and fix. They're probably using old equipment, but I have been thoroughly impressed that as we go into these places, especially like down in Southwest Virginia, where they are about 2 hours from Roanoke. The doctors are in Roanoke, but they zoom in to that particular hospital, and they have these amazing devices that are like Bluetooth digital devices, a digital stethoscope or whatever, and nurse can take the data right there at the
So
hospital
cool.
and send the data 2 hours away to a doctor who is zooming in, right? They have the ability to medevac. If there's a problem happening right there at that particular hospital, they can get someone from 2 hours away to Roanoke in under 45 minutes, right? So technology is there, but what's happening is the technology is available at the hospitals. But for those citizens who may live an hour or 2 hours away, they may not have high speed internet or broadband, right? And so it's hard for them to do telehealth. And so while we're focusing on rural healthcare, watch how it says all politics is local, how all these different things connect. We now have to advocate for expanding broadband in various parts of Virginia so that they have access to telehealth. And so those are things that we're focusing on right now. We finish up the fun part of the committee, which I'm calling the field trips. We've traveled all over Virginia. Now begins the actual work of the committee, where for the next two meetings that we're going to have, we're going to deliberate between ourselves and some of the subject matter experts, doctors, nurses, chiropractors, dentists, to figure out what pieces of legislation we can introduce in January to increase access in our rural areas.
That's fantastic. And with the broadband, that's another thing that came up around in Fredericksburg area with COVID. And
Mhm.
when the students were all sent home, so many families didn't have access to the Wi-Fi,
Yep.
the internet, the broadband. So they were home with laptops, but
Mhm.
no way to access. And that's Fredericksburg. That's not
Yeah.
even the rural areas.
Yeah.
So
Yeah.
that's
It was mind boggling
great
for
for
me. The first time I ran for office was way back in 2017. And I had neighbors less than 5 minutes around the corner from me who did not have high speed internet. They didn't have broadband. I'm like, wait, what? Y'all don't have internet at home? And so many of their children, if they had to do Canvas or different homework assignments, they were going to the Chatham McDonald's to sit in the parking lot at Chatham McDonald's just to have internet access so that they could submit homework assignments.
that's
Okay, we have three more questions. One from TikTok is: are there any healthcare bills that you think are not being spoken about enough, like in Virginia, that people aren't taking advantage of, or that?
Ooh, that's good.
Yeah.
I'm glad you asked because I have a list of bills here.
And you can pull these up on the website. I will say I did my homework. And so I went on the Virginia and I pulled up the health committee and I pulled up all the bills that you are accessing. I was shocked with how many deal with women's care.
Yeah.
But and there was the one fentanyl one that I pulled up there that you guys are going over. You can pull in this, but if you guys want to see all the list of every bill in Virginia and what's up for committee, go on to the Virginia Gov website.
Yeah. One of the major things we've been focusing over the past 2 years is senior health, right? Especially in our nursing care facilities. And so over the past couple of years, we have been trying to put more money into nursing care, especially for those maybe seniors with Alzheimer's or different things like that, dementia. We have, if I'm not mistaken, this past session, we've created, I think it was a committee to research Alzheimer's and what we can do to put funding at VCU to help with the studying and to figure out ways we can do to help citizens living with Alzheimer's, medications and different things like that. So that was a big bill that we passed that I didn't hear a lot of people talking about. Another bill that I was actually excited to carry, we did a major lift and push for sickle cell legislation throughout the Commonwealth of Virginia. A bill that I carried, HB 626. I love that because it's stitched, so that was easy for me to remember. HB 626, which is what we were able to do to create what's called a sickle cell registry throughout the entire Commonwealth of Virginia. There are people in the Commonwealth who have sickle cell. They may not know what that means, or they may not even know they have sickle cell. But with the creation of this registry, we'll be able to have people who will be placed on this registry. If for privacy concerns, they'll be able to pull themselves off. But that registry will be able to connect them to resources in their backyard. this is a shout out to the Fredericksburg Area Sickle Cell Association. There are people who are living in Fredericksburg who may not even know about FASCA, right? And FASCA may not have a list of people living in the community who have sickle cell. But we've now been able to close that gap with the sickle cell registry by linking people in Fredericksburg to FASCA and making sure that FASCA has a list of people on that registry so that they can reach out to them and all throughout the Commonwealth. And so I think this is really going to help people living with sickle cell and help them with access that they need. That's a thing that we passed. It was really exciting that we did it, but we don't hear much about it. And September is Sickle Cell Awareness Month. So that just happened to be one of the things we could raise.
I love that. No, and that's great. That's something that's perfect for patients as well, because sickle cell, one of the things that happens is you get a lot of back pain when you have a flare up. So we'll get patients in here and their flare ups are usually sickle cell. And we're not helping, of course, with the sickle cell or anything. We're helping with the muscles around it to calm down, because when those flares happen, it's painful. You can't move.
We need to get y'all on that list.
Yes, I know. That's what we'll send this out to the patients. Let them know. This is great. And that's one of the things, though, is too. It's amazing how everything's so interconnected, too, at every level.
All right, next question is, why do you think that people who need access to universal health care seem to be stereotypically the most resistant to the change?
Ooh, that is a good question. Oh, that's more like a philosophical question, right? But we've seen that, especially in like rural areas. There are people who say they can't stand Obamacare, but they're on Medicaid, and they don't realize that Obamacare is Medicaid, right? And so there is disinformation out there. There is hyperpartisanship that's out there. And so we have to do a job of educating people to make sure they understand how certain access to support services, how different things can actually impact them and help them out. And what I found, especially as knocking on doors, as you say, I knock on doors a lot, that when you have conversations with people, we're actually able to change their mind. And I know we're in this such divided, hyper-partisan area, especially during election cycles. But if you're willing to just have conversations with people, and if people are just willing to listen, we find out that people are able to change their minds if they're presented with the information and they know how it's going to help them. And so I don't know, as an elected official, I can certainly start having those conversations, but I'm not sure if there's an organization or a nonprofit group or a group of advocates who can start sharing the information and say, hey, this is how you would be impacted if you have access to healthcare. This is how you're impacted when insurance company run the government. This is how you're impacted if this happens, right? We definitely have to start having those conversations. And some people have to be willing to listen to. That's another big thing, because conversation works both ways. There's the person who sends the message, and then there's the person who receives the message. And we have to make sure that both we're listening and not just listen to respond, because we listen to people and then we jump at the gun ready to give them a response. But we also have to be willing to listen and hear people's concerns, hear their issues, and then how we can take that in and help them out.
Cool. I think a good one to wrap things up with is, someone asked, how can we better educate ourselves, or how can we educate ourselves better on facts about healthcare, and how do we filter through facts versus false information?
That's good. Now, I'm going to say something that's a little bit weird because we're on social media, but make sure you don't have a degree in me search, right? Because we'll see a bunch of people who will get on social media and they'll say, I've done my research. Please tell me more. And so we have to be very careful about what we are seeing on social media. And it's gotten so bad now with AI. AI is good in the proper context. But now, even if you just go to make a basic Google search, it's really, really hard to find true, legit information. And so one thing I would suggest is making sure that you are reaching out to those who are in leadership, those who, and you may be able to answer this better too, but those who are actually in the know, those who have been through schooling, those who have their degrees, right? Those who maybe have articles or documentation of how these things can better our lives, impact us, or how it's not a good thing or how it's a negative thing. And be careful of everything you see on social media. I have cousins who stay on TikTok. Hey, TikTok, I love you. But I have cousins who stay on TikTok and they're getting negative information or false information, and they're bringing it to me. And I'm like, who told you that, right?
I'm
And so
shocked
we
too.
have to be very careful. Yeah.
I do enjoy TikTok. Thank you, all the followers and everybody on. But it's funny because I'll see videos pop up and then I'll go like, oh, so-and-so said what on X. And then you go over to X and you're like, wait, this
Where is
wasn't
it
done.
at?
There
Right.
wasn't. And then you go back and it's like, oh, it's a false. So
Yeah.
even like just little quick checks, like don't just take it for granted. Go
And
to these
listen,
other platforms, look it up yourself.
I love my public education and that I receive kudos to Stafford County Public Schools. But they taught us how to research and check information, fact check. And there are Google, there's Snopes, there's different things out there where you can find out, hey, is this true? This was said at this debate, or this was said in this mailer, this was said in this commercial, or this was said in an article that I read. You can fact check it. And one of the things I love now is certain places on social media, community standards are being done where they can fact check certain things. But even when an article comes out, you can look at that article and say, hey, how much of this information is true? Or this information was reported. How can I find the truth about it? And so it takes a little bit of elbow grease to do the research. But if you want to make sure you're getting the right information and the correct information, you got a little bit, do a little research. And as Mama Odie says from The Princess and the Frog, you got to dig a little deeper.
You just got to keep going.
Yeah, it's so important. And be careful when you're taking everything at face value. You really have to do your research and find out what's there.
And like you were saying, talk to the leaders, talk to people. We get a lot of information and questions insurance, and there's a lot of people, a lot of things that we know and that we've come into contact with those questions. And people are very much like, well, I'm covered here, so why am I not covered? Like, what's going on in these fronts? And those are things that you guys can come to us about too, and we can help or send you into the direction to whatever, because
Absolutely.
they're all very tricky situations.
And if you know people, that's one of the things I do love about the social media era that we live in is that experts and different people in leadership positions are now easily accessible, right? And a lot of these people will readily respond to you if you send them a DM or you message them on social media and just say, hey, I've watched your videos. I see what you talk about, but I've also heard this from this area. Can you give some insight to this, or how true is that? It's amazing. I've reached out to various different congressional folks that I fanboy over all the time, and they respond. Or if I'm talking with them in person and I post a picture of us on social media, they will retweet it. And so it's amazing how easily accessible people in leadership have become nowadays, thanks to social media. And so take advantage of that. Make sure that you're reaching out to the people that you see. If there's a TikTok follower that you like who's posting truth all the time and they're holding people's feet to the fire and they're speaking truth to power, reach out to them and just say, hey, I see you're always posting this, but I have a question about this if you're willing to answer. And I found out that many of them are willing and able to answer.
And shameless plug, on our TikTok, one of the things that we big about is that evidence-based chiropractic care. And so one of the things that you'll notice on our videos is, yes, some of them are clickbait, but we do put the research links in the bottom. So then you guys can go right to those journals, those articles, and most are open access or full access enough where you guys can go and see what we're reading from, because we don't want to be putting out any non-information or doing anything that's going to scare you away from the profession. So please reach out anything. We're available. And then we can also help you out. Please reach out to Delegate Cole. I mean, we couldn't do this without you. Thank you so much for everything you do in the area.
I appreciate it. I'm glad to be here. And again, if you all want to follow me, I'm on all social media platforms at jcole, the number 4 VA. And if you're on X, formerly known as Twitter, it's just at Joshua Cole. And don't hesitate to reach out. You can ask me any questions. And if I don't have the answer, or I may not be your delegate, I will refer you to the best area where you can get your help.
Yeah, thank you guys.
Thanks, everyone.
Yay, thank you. That was awesome. That was good getting to talk with you about everything. There's so much information.
So I was trying to
I'm sorry.
and
Oh my
repost.
gosh, I have such bad service in here. It was funny. I didn't realize how tricky talking about Wi-Fi. Moving in this building, we could not get internet, business
Really?
internet versus
Not even
home.
Cox or
It took us over a month to get Cox